Hey guys, welcome back to another video. This video will cover phase 3 of a rotator cuff repair for a small to medium sized tear for the timeline of weeks 7 to 8. The goal of phase 3 is to not overstress the repair, to decrease pain, manage your swelling, to progress from active assisted range of motion to active range of motion. So that means to progress from helping the helping the shoulder move to having the shoulder move on its own. And last but not least, progressing to engaging the scapular muscles or your shoulder blade muscles even more. At this point of the rehab, there should be no more sling. That should have been discharged from the surgeon. You should be letting the arm hang at this point to allow mobility to occur. And in terms of the precautions, there's no lifting more than 10 pounds. For the exercises in phase 3, some of them are new and some of them are progressed. They're the same exercises, but a little bit harder. The first one is external rotation with a cane. This is similar in phase 1 and phase 2, but you can go a little bit further now to something to about 30 degrees. So you want to bring this out. Let's just say the right one is the one that we're working on. So this is about 30 degrees here, 10-second holds, 10 times. Go back into it, hold for 10 seconds, and then resume for 10 reps. When we're doing these exercises now, because we're progressing into active range of motion, we're trying to engage the muscles in the right shoulder a little bit more. You no longer really need to use the left to help the right or have the right go along for the ride. You really can use the right to just push out and have the left push into it as well. Next one is just pure shoulder flexion, so just bringing the arm up. You can bring it up a little bit higher now to something about 120 degrees or so. So this is shoulder flexion. So if this is 90 degrees here, this is about 120 degrees here. All the way to the top is about 180. So, and then midway you're about 145 there, 90 here, so somewhere in between. So this is essentially the exercise. You're just bringing the arm up. I usually have my folks do this about 10 to 20 times. If for whatever reason you tend to compensate, the most common compensating pattern I see is people tend to do this. They'll arch their back to try to get the shoulder up. One way to help prevent that from happening is to lean your back against something and then lift up. So you stabilize your back, but really focus on lifting that shoulder. Wall walks is the next exercise to help with getting the arm up and over into overhead motion. So with this, you just need a wall that's somewhat slippery, and if it's not, use a pillowcase, because mine's not really that slippery. So you use this one because we're going up a little bit and we're working on end range mobility. You're using the left just to help the right a little bit, but you're also using the right as well. So when you're doing this, you're bringing it up as high as you can, holding it for 10 seconds, and then you repeat for 10. So it looks like this. Your left is helping the right just a little bit. You're going as high as you can, and then you repeat from there. Next exercise is on your back. This is called the Serratus Punch. And essentially what you do is you get the shoulder, reach up towards the ceiling. This is the starting position. And then you reach up towards the ceiling even more to ensure the shoulder blade is not touching the table. And then you slowly bring the shoulder blade back into the table, keeping your elbow straight. That's one. And you punch up again. Usually I have people hold this for about 5 seconds or so, and then I have them bring them back and I have them repeat this for a total of 15 to 20. So the next few exercises are considered strengthening. This is a light band to moderate resistance. So I would start with something light first just to see what you can tolerate. Really, if you're doing this and this is painful, then you're likely not ready for this yet. But most of my folks, when we do this, we're doing okay, especially when we're at week 7 to 8. So the first one is a shoulder roll. First things first is make sure you set your shoulder blades. By setting the shoulder blade, I mean squeeze them. You don't need to squeeze them all the way, but you do need to preload them. So pre-engage them, Make sure there's a little bit of tension in the mid-back between your shoulder blades, and then you hold that, and then you pull, and then you go back. Even when the arms go back, your shoulder blades are still a little bit squeezed. I'll probably say about 50% effort on the shoulder blade squeeze here, and then you're just pulling. I usually have my patients do this about 20 to 30 times, depending on what they can tolerate. Next one is shoulder extension with a band. You use the same band. So when you start, again, preset the shoulder blade, maintain that the entire time during the exercise, so make sure the muscles are retracted there in the shoulder blade, maintain that, and then you just pull back with the arms straight. Make sure you go past your hip, and I usually have my patients do this 20 to 30 of them. Tricep extension is the next exercise, very similar to the shoulder extension. So what you do is first of all, you grab the band tight, keep the elbow bent, and then from there, again, still set the shoulder blades a little bit, and then you just straighten out your elbows from there. So just make sure when you grab the band, it's nice and tight already. So a lot of times when I have patients do this in the clinic, the most common mistake is when they grab it, the band is already slack, and then by the time they're pulling it, it's not until about halfway through where their elbow is almost straight is when they experience tension. I want tension at the start of the exercise. So meaning like the minute you start extending, there's already tension. So that's why I have people grab the band really, really tight to start off with. So when you extend through, you get full range of motion and resistance for that entire range. Same number of reps, about 20 to 30 is what I usually have my folks do. Bicep curls is the next exercise. You just need a long band. You can just step on it. And then from there, make sure there's tension when you're starting, and then just go into your curls from there. Just make sure there's tension in the entire range of motion to encourage the maximal benefit from the exercise. 20 to 30 is the repetition to shoot for here. Bilateral external rotation is the next exercise. We're using the same band. The only thing here is you want to grab it a little bit closer, so there's going to be tension right when you start. Another thing to take into consideration here is the precautions of limiting external rotation to about 30 degrees here on that right side, or that surgical side. So the actual exercise looks like this. You set the shoulder blade, keep them a little bit squeezed, and then external rotate all the way out. So if you have a precaution of keeping it to about 30 degrees here, in reality, it'll probably look like that. So in the clinic, most of the time, when people are at about 7 to 8 week timeline, they're looking like this anyways at their maximal effort because the muscles of the right side is weaker. And this is likely for those of you who can exceed through the 30 degrees, just be more mindful that you want to not go as far on the right side, and for the other side, you can go as far as you can, but always using pain and irritability of the shoulder as a guideline to see what you can and cannot do. After these exercises, if you are sore, please feel free to use ice for 10 to 20 minutes to help alleviate some of that. That's all I have for you guys for phase 3. The next video, I'll go over the exercises we'll do in phase 4. I'll see you guys in the next one. Thanks for watching.